Hello, and welcome again to our dialogue series here, hosted by the Princeton and University of Tokyo Strategic Partnership. This is one in a series of talks that my colleague, Professor Masashi Haneda, to my left here, I don't know where he is on your screen, he and I have been hosting this dialogue, which has been a really fantastic opportunity for us, and I hope for those of you who are listening to learn from colleagues at both Princeton and the University of Tokyo who are experts in a range of areas that are related to or whose work is informed by the impact of the past year and a half, the COVID-19 pandemic. And we've heard a lot about the implications of the pandemic for international relations, for example, for the economy, for gender. Today, we're going to hear from colleagues talking about population health, very broadly defined. Of course, one of the most directly impacted areas of social and policy relevance in the pandemic. But before we jump into that, and before we introduce our two speakers for today, let me take just a minute to say a couple of words about the partnership. This is a connection between the two universities that's really provided quite a wide range of really important and exciting opportunities for collaboration and exchange. The partnership has been in existence for what now, 8 or 9 years, 2013. The partnership was established and has been going strong since. The partnership has funded, supported, I think, 27 projects now, involving colleagues from both of the two universities, and not just in the areas that I mentioned, which are primarily the social sciences, I guess, but across the entire range of disciplines. We have people in astrophysics, architecture, evolutionary biology, and so on, who have been working with us as part of the partnership to establish more direct and deeper connections between the two universities. And I should say that one of the things that's been really a main focus of the partnership has been exchange, both exchange of faculty and exchange of graduate students and undergraduates. And this is something that we've obviously really missed over the past year and a half with all of the travel restrictions. So I think I speak for all of us in saying that we are very, very excited for what we hope will be a resumption of these fruitful exchanges in the year to come and beyond. So here's keeping our fingers crossed for good news on that front going forward. So with that brief introduction of the partnership, let me take just a couple of minutes to introduce my colleague and good friend, Noreen Goldman. She is a professor of demography and public affairs here at Princeton. And Noreen did her PhD at Harvard in population sciences. And she has spent most, not all, but most of her career here at Princeton, where she has been affiliated and played a major role in the Office of Population Research, which I think it's worth noting is the oldest population research center in the United States, and certainly one of the most well-known and respected in the world, and coincidentally, one of my own intellectual homes here at Princeton. Noreen is a demographer with tremendously broad interests. She's published numerous papers in fertility, nuptiality, morbidity, mortality. If I'm not mistaken, migration and immigration, Noreen, may be the one area where you haven't spent a lot of time, maybe a little bit, but really covers a wide range of areas. And importantly, her work is really important for its contributions to formal demography as well, the mathematical study of demographic processes. And in recent years, much of Noreen's work has focused on health and mortality at older ages, obviously an issue of importance in Japan, not just the US, Taiwan, where Noreen has also done work as well. And this work includes the use of both conventional demographic tools and data, as well as newer types of data, including biomarker data, genetic data as well. Currently, she is the investigator of a large-scale study of cardiovascular health among disadvantaged adults in the United States, And very importantly for today's topic, she's been very involved and documented in trying to understand the health impacts of COVID-19 in the US, not only in the US, but primarily in the US. And this is really, she's gotten a lot of attention for the work that she has published on the remarkable reductions in life expectancy due to COVID deaths. So welcome, Noreen. Thank you for being here and taking time to share your thoughts with us on this. With that, I will turn things over to Masashi, who will introduce Professor Tanaka.
Yeah, thank you, Jim. Compared with Princeton, the size of the University of Tokyo is huge, much larger than Princeton. And we have more than 4,000 researchers on campus. So I have known the name of Professor Tanaka Ryuichi well, but this is the first time that I met him, that I see him on screen. Very nice to see you, Professor Tanaka. And so my introduction of Professor Tanaka is just very brief because I don't know him personally. He obtained his PhD in economics in New York University, and he has been a professor at the Institute of Social Science since 2017. So he has been working there as a professor for 4 or 5 years. Before that, of course, he was an associate professor there. And he is an expert of labor economics and economics of education. And he has been working on the effect of massive inflows of immigrants on education system of receiving countries, yes. And at the University, at the Institute of Social Science, they are now organizing a kind of whole project. I don't know quite well the expression in the institute, but anyway, a project to which all researchers, in which all researchers are participating, which is called the Methodology of Social Sciences. And there, Professor Tanaka is the leader of the initiative called Social Science of COVID-19. And the group has been working on various aspects of COVID-19's impact on society, including social sciences. We had an opportunity to listen to two astrophysics, the experts of astrophysics who discussed a lot about the COVID-19's impact on sciences and astrophysics. And today, I look forward to listening to the discussion about the impact of COVID-19 on social sciences between two distinguished researchers in the field of social sciences. That's all. Jim, please.
Okay, yeah, thanks. And I think that what we're going to do today is to ask each of you, I think you've prepared some slides that you'd like to share just to sort of provide a brief overview. Maybe we'll start with Noreen and then follow with Ryuichi, and then maybe 5, 6, 7, 8 minutes, whatever it takes to present the sort of overview of the topics you'd like to discuss. Please go ahead, and then we'll open things up after that for a conversation. So Noreen, if you'd like to share slides, we can go ahead and get started. Thanks.
Okay, well, thank you very much for that very kind introduction and for inviting me to take part in this discussion. So let me give kind of an overview. My work on COVID has really focused on the consequences for health and survival of different vulnerable, disadvantaged racial and ethnic groups in the US. And I'll talk particularly about Latinos. It's a word that we use as a synonym for Hispanics in the United States. So immigrants and higher generations that came, many from Mexico in the United States, but more broadly from different countries in Central and South America. So that refers to Latinos, and I'll also talk a little bit about the Black or African American population. And I'll start just showing you the slide that my former student, Teresa Andresfey, and I produced in an article that was published a year ago, asking what has the impact been on life expectancy of the different racial and ethnic groups due specifically to COVID in the United States. And so what we looked at is life expectancy at birth. It's a measure that just summarizes death rates in a given year. as if people would experience all of the age-specific death rates in 1 year and then ask what their life expectancy would have been before and during the pandemic. And the main point that's received a lot of attention and very depressing kind of news for the United States is overall life expectancy in 1 year dropped by 1.3 years in the United States. That's one of the highest, if not the highest decline in the world in this 1 year span, second only potentially to 1918. Perhaps there's some debate about 1 year during World War II. So it's a massive decline. And when you look at the differences across groups, the point that I focused on is the Latino or Hispanic population had a decline of 3 years, okay, just due to COVID, and the Black population about 2 years due to COVID, but some more due to death rates from other causes that went up during this time. And the other point I want to make that's a surprise to many people, knowing that it's an largely immigrant population with relatively low income, is that prior to this pandemic, Latinos lived longer than other groups. All right, you can see this line is 2 to 3 years higher than it is for the white population. It's something we call the Latino advantage or survival advantage. Some people call it the Hispanic paradox, a paradox because we would expect this group not to do as well given income and education and other factors. Okay, and my colleague and I just in the last few weeks tried to estimate what would happen in 2021. What I just showed you went through 2020. The problem, of course, is we don't have a full year of data, but these green lines show you the best estimates a little bit redone for 2020, and then they compare that with the impact on reducing life expectancy just on deaths through the first week of October of 2021, all the data we had at that time due to COVID, and then using estimates by a group that does simulations in the United States and simulates the expected deaths for the rest of the year, what we anticipate by the end of 2021. So it's a projection, right? And the really horrific news is that 2021 is likely to be worse than 2020. Okay, it's especially worse proportionately for the white population, but the overall impact remains huge for the Black and Latino population. Again, a 3-year decline from what was pre-pandemic to 2021, virtually the same as 2020, despite the introduction of vaccination very early in 2021. Okay, and we haven't published this because some of it is still a projection. But it looks like the disparities will be as big, except for the fact that the whites have done somewhat worse, making it look like the disparities are a little smaller, but not because either Latinos or Blacks have done better in terms of this really horrific impact on survival. Okay, and it's funny, in 2015, I wrote an article asking whether this advantage of Latinos, the fact that they live longer than whites, will continue. And of course, I didn't foresee an infectious disease outbreak. And I pretty much said, probably not, but not for that reason, but for other reasons I can go into, like high rates of obesity and diabetes and disability and stresses of immigration and harsher attitudes toward immigration. Prior to the pandemic, there was absolutely no sign that that advantage was getting smaller. In fact, it was getting bigger because whites were doing worse. But then in 1 year, in 2020, it was almost eliminated, and 2021 will look pretty much the same. There'll be virtually no advantage in survival left. Okay, and we can talk more about this later, but one of the issues is, why did Latinos do so poorly? And again, I'm happy to return to this issue. I list here some reasons, both because they may have been more exposed to infection, and also because given exposure to infection, they may have had higher death rates for a variety of reasons, many of which apply to several disadvantaged groups, but several of which, and I put an asterisk here, are especially likely to affect Latinos because many are undocumented, have inadequate health insurance, if health insurance at all, are ineligible for benefits, have additional language barriers in understanding potentially how the disease is spread and how one can protect themselves living in multi-generational households. The point I want to say something further about is this issue that's received a lot of attention of what we call frontline occupations, holding jobs that cannot be done remotely. You know, all of us have been able to operate pretty much completely by using our computers and staying at home. Of course, there are many jobs where one cannot do that. And many of those are held by Latinos. So this table just looks at several different racial and ethnic groups in the US. And prior to the pandemic, what proportion were in these kinds of frontline jobs that couldn't be done remotely. And the highest value, at least among men, is for the Latino population, and almost the highest value, with the exception of Vietnamese, for women. So they occupy jobs that can't be done remotely, that expose them to many risks. This final slide on Latinos, it's a hard one to read, but the point we tried to make here is not only were they likely to hold frontline jobs, but they were disproportionately likely to hold the kinds of jobs that had high risk of getting an infectious disease, which meant these diseases were characterized by a separate data set as being subject to infection, had very close contact with other people at work. All of these couldn't be done remotely. They're all frontline jobs. They had a lot of face-to-face exposure with other people. They couldn't be done outdoors. They were done primarily indoors. And many of them involved external customers. And when you took those kinds of frontline jobs that had high risks and you broke them into different quartiles according to their status, where status is measured by the average occupational level of people who occupy those occupations, where Latinos are overrepresented, overrepresentation being this orange color, is in the first quartile, the lowest status jobs that imply high risk according to these various risks, right? They're vastly underrepresented, as shown in green, in the highest quartile jobs. It's also true for Black men and women. It's not true for the white population that are overrepresented in the jobs of the highest status. So for example, in the healthcare industry, these would be nurses and doctors. For Latinos working in the healthcare industry, it would be something like home healthcare aides. And these lowest quartile jobs are the ones that are least likely to have protections in effect, either because people are unaware of them, they don't have access to personal protective equipment, or employers are not providing that to people. Okay, and the final things I would like to say here very briefly is some very recent work about to be published paper with two of my students, looks at the Native American population, one that's even more disadvantaged in many ways than the Latino population. So that consists primarily of what are called American Indians, but also to some extent Alaskan natives, okay? And if we look at, we don't have life table estimates for this group. In fact, the US has really pathetic kinds of data for this group. What we were able to do is get a mortality rate that we controlled for age, that we standardized for age, just to point out that this group has even higher COVID death rates relative, these are relative to whites, compared to either Latinos and Blacks. So Latinos have 2.3 times the standardized death rate than whites. Native Americans, it's 2.8. And for many of the same reasons as Latinos that we can discuss, the living conditions, the poverty, the multi-generational families, in some cases, high rates of diseases, other diseases that made them more vulnerable to COVID. The final thing I would like to say that's a big point of this paper that we try to understand is if we look at the states that have the highest Native American population, and I picked here the 16 states that do so, and we compare these death rates, these standardized death rates in 2020 from COVID for Native Americans against the proportion of Native Americans who live on a reservation. Okay, so a reservation here, an Indian reservation is land that's governed by a tribal nation rather than the state government. And what you can see here is a pretty high correlation, so that it's not just the case that Native Americans are dying at a very high rate during 2020, but those who live on Indian reservations for a variety of reasons have been especially likely to do so. There are currently over 300 Indian reservations in the US, and about less than 1/4 of Native Americans live on the reservation rather than off in either urbanized areas or other rural lands. So that will introduce some of the topics I would like to talk about.
Wonderful. Thank you, Noreen. That's very sobering, but thank you for sharing that. Ryuichi, can you, when you have a chance here, jump in and share with us what you'd like to put on the table?
So thank you very much for this opportunity, and thank you for inviting me to this very exciting discussion. Let me talk a little bit about the things I'd like to discuss today. So in principle, I'd like to discuss two things today. The first one is about the general trend of the Japanese population and the impact of the COVID-19 on the population issues in Japan. The COVID-19 actually impacted the various aspects, including the health and the population. But the population problem or the declining population is a structural problem of the Japanese society for a long time. So the current Japanese population is 125 million, according to the population census, October 1st of 2020. And actually, this number was about 72 million at the end of the World War II. So we experienced the expansion of the population over the 70 decades. However, now the Japanese society is in the phase of the declining population, and the largest population was hit in the 2008, which was the 128 million. And the Japanese structural problem is a population decline, as I said before, and the more problematic phenomenon is the rapid population aging due to the low fertility. And these problems are actually accelerated by the COVID-19. And the report from the Ministry of Health reported that 2% decrease of the childbirth and the 5% decrease of the reported pregnancies in 2020. So let me show some figures here. So this is the number of the childbirth in the past 1 year, including the current month. So the frequency of the observation is a month, but the number is the number of the childbirth is in the past 1 year. Okay, so if you divide these numbers by 12, then you can look at the average numbers, the monthly numbers for the past 1 year, including that month. And the orange line here, the vertical line is the date when the Japanese government declared the state of emergency at the very beginning. I mean, the first state of emergency. Okay, and the solid line is the actual number of the childbirth in the past 1 year, and the dashed line is the estimated number of the childbirth using the data from the 2016 to the right before the declaration of the state of the emergency. So from these numbers, from these figures, we can see that actually childbirth is steadily declining at 0.3 annual rate. However, after the COVID-19, after the statement of the emergency, we observed we actually did not observe the decline of the childbirth for 10 months. But after the 10 months, we observed declining the childbirth. So this is actually, the consistent with what the Ministry of Health reported, the declining the child pregnancy and the childbirth. Okay. And one reason of this declining, the declining the childbirth due to the COVID-19 might be the declining the number of the marriages. So this is again the number of the marriages in the past 1 year, including the current month. And this red line, the vertical line, is the date of the declaration of the state of emergency, okay, which is the April of the 2020. Okay. And again, the solid line is the actual number of the marriages in the past 1 year, including the current month. And the dashed line is the expected, the fitted value or the projected number of the marriages using the data before the statement of the emergency. Yeah. So here we can clearly see that the big decline of the numbers of the marriages right after the the declaration of the statement. State of the emergency. And actually this decline is about 8% of the numbers of the pairs of the marriages. So I would say that this decline of the number of the marriages is one potential reasons of the declining the childbirth due to the COVID-19. Okay. So summarizing these two slides, the number of childbirths has been declining structurally, and this is actually the long run trend of the Japanese population. But the number of the newborns started declining about 10 months after the declaration of the state of emergencies. And this is consistent with the decline of the pregnancy reported in 2020. And yeah, so of course, the detailed analysis should be needed, but by looking at these two slides, I would imagine that the decline of the marriages seems to contribute to the above decline of the childbirth as well. And this impact may persist through the lost timing of the childbirth and the change of the lifestyle, including the remote education, remote work, and other things, and the lost employment and incomes, and increase of the cost of childbearing and the child rearing. So this is the end of the first part I'd like to discuss, but the second part is slightly different. So should I continue or?
Please go ahead. Yeah,
okay.
why don't we share what we want to use as a basis for discussion, and then we'll go from there. Thanks.
Okay, thank you very much. Yeah, so I continue. Okay. So the second set of things I'd like to discuss today is the reaction from social scientists in Japan to this pandemic of the COVID-19. So yeah, all over the world, there are many platforms were made to gather and share research results related to the COVID-19. And this is the same in the Japanese case. And for example, I'm an economist and I'm a member of the Japanese Economic Association. And the Japanese Economic Association started the website here to collect the research output related to the economics and the COVID-19. And now that website listed more than 170 papers and the research output, all are related to the COVID-19. And from the social scientist point of view, the pandemic is a kind of a good experiment to study how society reacts to the crisis as this pandemic. And as Professor Haneda introduced me, and he mentioned, kindly mentioned the project now the Institute of Social Science is doing which is the whole institute project, and the part of that project is on the COVID-19 issues, and so I'm leading the one group focusing on the issues of the COVID-19. And another leader of my group is the Kenneth Mori McCarran, who is the political scientist. Yeah, so this is a picture of our project. So our project is called the Methodology of Social Sciences, and the subtitle is How to Measure the Phenomena and the Values. And our group consists of mainly the 4 research groups, and the measuring society, and the philosophy of the social science, and the method of law, and the social science of the COVID-19. So I'm leading this group, and in principle, we are collecting the data and the researches, and we do our own research related to the COVID-19 phenomenon. And so far, of course, the COVID-19 is still, going on, and if we would like to do some empirical analysis, we need to collect that data. So everything is still going on, but I'd like to introduce some of the research output from our research group, the member of our research group. The first one is Fujihara on the youth life, and he's a sociologist, and he studied the data of the 19 and the 20 years old panel, and he found that the COVID-19 affected severely the availability of the subsidiary part-time jobs for the college students, and the negative feeling about the college education increased from the December 2019 to July 2020. And the mental health of female deteriorated. Yeah. So from the sociologist's point of view, he collected the panel data, and he found the negative impact on the mental health of the females and the young, around 19 years old or 20 years old in Japan. And another research by the Kawata, who is an economist and a labor economist like me, and he studied the impact of the COVID-19. In particular, he studied the impact of the declaration of the state of emergency on the job search activities. And he found that the number of effective job seekers has changed significantly. Actually, they reduced a lot. Due to the COVID-19. I mean, the statement of the declaration of the state of the emergency in the April of the 2020. And in particular, this decline of the job seekers, the part-time workers and the female workers. So the state of emergency had a substantial impact on the reduction of the job seekers in the labor market. So two more papers. The first one is by the Shoji and other members, including the Kenneth Mori McCarran, on the preventive behaviors of the people. So they collected the original data through the online survey, and they found an increase in the confirmed cases of the COVID-19 is negatively associated with the likelihood of the risky behaviors, such as the face-to-face conversations and the dining out. So the people care about the actual case, the number of the cases around them, and they start avoiding the risky behaviors, like the dining out in the restaurant. And another interesting finding by them is, so this the change of the behaviors, the risky behaviors, strongly observed for the college graduates, and the change of the behavior is not strongly observed for the high school graduates. So they found some heterogeneous reactions by the level of final educational achievement. The final one, which is by the Oikawa, and I am also the author of this paper, studying the effect of the social distancing in school. So the school closure was implemented in the May 2nd of the 2020 in Japan. But after 2 months, so the Japanese schools were reopened. But still the COVID-19 is going on, and it is very important to keep the safety of the children in schools. So we studied the empirical relationship between the class size in school, the primary schools and middle school, and the incidence of the class closures due to the infectious disease in schools. And we found that the small class size is effective to prevent the school closures and the class closures due to the infectious diseases. So the wrapping up, taking advantage of this the COVID-19 pandemic phenomenon as a social experiment, the many Japanese social scientists are working on the empirical analysis. And we are still, keep on doing the research using this COVID-19. Okay, thank you very much. That's it.
Great. Thank you, Ryuichi, for that. You covered a lot of territory, and the project sounds fascinating. I have many good colleagues at Shakan, and I look forward to hearing more about that when I have a chance to visit. So what I'd like to do now in the time that we have remaining is hopefully to give you both an opportunity to follow up on each other's comments or discussion. If you have questions or things that you'd like to pursue a little bit further with each other, I'll open it up to either one of you if you'd like to follow up on the other's presentation.
So may I?
Please.
Ask? Okay. So Noreen, thank you very much for very interesting research output. And I'm very interested because I'm also very interested in the immigration type of things, research. So I have actually 2-3 questions for your presentation. The first, so to understand the background. So you mentioned the Latino paradox. So I'd like to know what is the reason why the Latino has a longer life expectancy even before the COVID-19. Mm-hmm. So that's my first questions. And related to these questions, so you mentioned, so if I understand correctly, you said that the huge decline of the mortality, the huge decline of the death rate of the Latino due to the COVID-19 is mainly not due to the infectious diseases directly, but the increase of the diabetes and other things. So if that is the case, why did we observe the long life expectancy for the Latino even before the COVID-19 pandemic? And the final question is, so how large extent could you explain the different impact of the COVID-19 on the death rate by the difference in the income and the difference in education? So you mentioned the heterogeneous impact of the COVID-19 on the death rate across the ethnic groups like Latino, or even for the Native American group. So I'd like to know how large extent that this different impact is accounted for by the different education and different income. Okay.
Thank you. That's a great set of questions. And some of them we would love to know the answer. So let me start with the obesity and diabetes, because I think I do have a habit of talking quickly, and I try to get through this quickly and may have created a bit of confusion. So when I wrote the paper about will this advantage endure, that was 5 years before the pandemic. And the reason I thought it might not was because Latinos, they live longer, which means they must have better health in many ways in order to live longer. And that's true. They have lower rates of heart disease, lower rates of cancer, but they don't have lower rates of obesity and diabetes. Those are two diseases for which Latinos, for the period in which we have data, have had higher death rates, higher disease rates than whites. And those are also two diseases that put you at risk of COVID. So there are many diseases that put you at risk of COVID. These are two important ones that are particularly high among the Latino population. I was speculating that just obesity and diabetes and disability would be a problem, without thinking, of course, that when COVID came to be, that would also put them at particular risk for COVID. Okay, all right. So it's that decline in life expectancy is a COVID decline in life expectancy. 90% of the overall decline that Latinos experienced in 2020 was directly due to COVID.
I see.
A higher proportion than any other ethnic group was directly COVID. So you ask, why have they lived longer? That's a question researchers have tried to tackle. It's like a classic demographic problem. We don't have a great answer. The best answer I can give, I've done research on it, is the single most important reason is lower rates of smoking among Latinos than whites, particularly in the past. Because if you look at death rates today, of course, they're largely generated by smoking years ago, not smoking today. It also has to do somewhat with selective migration. I think not so much about who comes, let's say, from Mexico to the US, are they healthier? But in my own work, it looks more important about who goes back. So if people who are sick are more likely to return to their home country, we don't measure them in the death data. They become a death record in their home country, and that makes it look better. So I think there are a few reasons. I think those are the dominant reasons for why Latinos have maintained an advantage that seems will no longer be. Maybe post-COVID, they will regain it, but those 2 years, there's virtually no advantage left in 2020 or I think 2021. So your last question was how to explain differences across groups, ethnic groups. It's something I would love to quantify, do a classic breakdown, decomposition of, it's impossible because we don't have the kind of data. Even the frontline jobs data I gave you with the year prior to the pandemic, trying to look at employment through that's constantly changing as people lose jobs, as businesses shut down, as businesses reopen. It's very, very hard. I think for both the Latinos and the Native Americans, poverty was clearly one of it, but poverty itself operated through particular mechanisms, right? And I think one mechanism was these frontline jobs that were very low income, low status jobs, often for Latinos in the informal labor market, completely without any kind of protection. I think for both those groups too, they both have the highest rates of living in crowded housing in multi-generational families. All right, so transmission within a family was extremely high. Native Americans have very high rates of very poor infrastructure, lack of running water. I mean, a disgrace in the United States today to think of households without adequate plumbing or any running water. And that's the case, particularly in many reservation lands. And Native Americans, even more than Latin Americans have, Latinos, Latin Americans in the US, have very high rates of many diseases that put them at higher risk of COVID. At the same time, they have probably the highest vaccination rate of any group in the United States, which is itself a fascinating question, but I don't want to take away from my ability to ask you a couple of questions. So I'll hold off the fascinating vaccination story. but it's okay, Jim, if I go
Please,
ahead
yes,
and ask
absolutely,
Ryuichi.
please. Yes,
Okay,
perfect.
well, thank you very much for your talk.
Thank you.
So your issue with declining fertility struck me because that's also a fear in the United States. We're gradually losing what was, not so low fertility compared to other high income countries, even if it was slightly below replacement. And I just saw something this weekend, actually, that showed that in a survey, when young Americans were asked about their fertility intentions, there was no evidence of a change, right? So it raises the question, will there be this makeup effect? But of course, not everything can be made up, right? Some people may age out. Some people may have unions dissolved, partners lost, and other explanations. So, we may or may not be able to make that up. And you also raised that issue about these platforms for academic output, which I know much about because several of the papers I've shown you have gone on a very well-known website, Medical Archives, right? We just had tens of thousands of papers. And that kind of making research available is great. And the cooperation among researchers is great. But it also has produced a lot of concern for people that, right, the difference between what's peer reviewed or what's just put up on a platform has created a lot of confusion as to, what should we believe? I just look at these drugs that have been promoted as cures for COVID in the United States, and you can find tons of articles establishing their efficacy, not just our former president, right? And that's, and that's very concerning when, these are not peer reviewed or scientifically correct papers. So I'd love to know sort of your thoughts on the pluses versus minuses of this increase in cooperation and platforms without peer review.
Okay, thank you very much for that questions on my presentations. The first one is about the intention of having a child among couples. So I think the once they are married, then so they want to have a baby if they want, and I think that tendency has not been changed a lot between before the pandemic, before the COVID-19 and after the COVID-19. But my point is the decline of the marriages. So in Japan, it is quite not difficult, but it is due to the social norm. The out of marriage birth is quite rare in the Japanese societies. So the mating or the marriages is a kind of the key factors to intend to have a child. So due to my calculations, so the decline of the marriages. So probably the people who get married even after the COVID-19 still have an intention to have a babies, but the total number of the people who want to have a baby or who intend to have a baby decline. So that's my interpretation. Yeah. And the second question about the platform. Yeah, this is really important issues. And actually, the many people, including social scientists like me, worked a lot on the issues related to the COVID-19 in past 1-2 years. And there are many papers, the empirical paper, theoretical paper, simulation-based papers, and there are many papers only in the economics field. However, the papers and researches published from the platform is, of course, as you said, it's a mixture of the already published from the scientific peer-reviewed journals and still the discussion paper level output. So it is quite important to have a timely results, prompt outcome in this situation, but we need to change the phase to check the quality of the research output as well. So I think it's important to update the information of each papers on the platform. So So it used to be the discussion papers or just a discussion paper on the platform. But once they are getting published, then the information should be updated, and the authors contribute to the platform should be responsible for the updating process of the informations on the platform. Yeah. I think we need to move to that phase as soon as possible. Thank you very much.
Yeah, not an easy phase to move to, of course, right? Because I know there were various efforts in the US to have people review papers as they went up on the medical archive informally. And as far as I can tell, a lot of those efforts just fell apart. The idea was they would review them in 2 or 3 weeks, but people don't have the time to do that, right?
Exactly.
And,
yes.
Right. And so it becomes and the same people who are good reviewers are in particularly high demand. And if you get people who don't often review, then it's a problem in itself. And so given that this is a non-paying type of job, right? It's a volunteer job. It's a tricky thing to do.
Yeah, I completely agree.
Yeah.
All right, thank you both. I'll jump in with just a quick thought, Ryuichi, on your response to Noreen's questions about the fertility intentions. I mean, this is the area of research that's very near and dear to me, and this is fantastically interesting. And one of the things that, I mean, everything you said, I agree with completely. And one of the things that was very interesting was this long period of conditional on marriage, as you said, stable fertility intentions, almost no change. But there was a slight change just before, in the 5 or 6 years before the pandemic. So it'll be fascinating to see whether that continued or was accelerated during and after the pandemic. But what I really, really want to see, and hope we can have a chance to talk about someday, is marriage intentions and the extent to which the chaos, the uncertainty, the observed increase in the difficulty of balancing work and family, all the processing of all of this, whether that had any implications for what were already kind of ambivalent attitudes towards marriage among young Japanese men and women. So a topic for another day, but thank you for bringing that up. We're getting close to time, so I will ask Masashi if there's anything that you would like to bring to the table here. In terms of questions.
I am very impressed by, how to say, the difference of approaches you both of you take. Although you use the social science approach, how to say, grouping people, a way of grouping people is quite different, which represent, in my opinion, some characteristics of each society, the US and Japan. In Maureen's case, you group all people, you divide people of the United States into ethnic groups. And on the contrary, in case of Japan, Ryuichi explains everything by using the term Japanese or Japan. And this is, so it's a kind of single group in case of Japan. And so Ryuichi asked Maureen, what's the difference between the income, people of income or people of income's difference or age difference, etc. And as a whole, we are used to discussing everything in the framework of a country or nation state. Because in Japan, that's all. There is no other group. We believe, but in fact, that is what I want to ask Ryuichi. In fact, there are a number of non-Japanese nationals living in Japan. Do you have some correct data of the impact of COVID-19 to them?
Well, I think it's very, very important point, and it's very important question. However, I don't know any available data specific specifically in asking the impact of the COVID-19 on the non-Japanese, I mean, the immigrants populations. So I think we should, start collecting the data.
If we take the same initiative, same perspective with Noreen, we need to collect the data to compare the Japanese and the US society. But in case of Maureen, maybe you need to discuss more about the whole United States society, US society. That means the group of US are not always divided into ethnic groups. Maybe we can divide these people of the US into groups by using other index like age or language or richness, etc. But I'm not quite sure. You don't have any other way of observing the US society, by not using the ethnic difference.
Yeah, so you raise a very interesting question, and I think a lot of it has to do with ways in which America is different from many other countries. It also has to do with my own research, which is focused on racial and ethnic disparities, right? So, you know, there are many people who also consider disparities, but for example, have focused on educational disparities or income disparities, which are also highly correlated with racial and ethnic disparities, right? And they're huge in the United States. I mean, that's the other thing. It's not only that the US is sort of race conscious, even more so now, there is a more concentrated effort to focus on disadvantaged groups in recent years. But there are just huge differences across society in many different indices of income, education, access to resources, access to healthcare, right? We don't have a national healthcare system. So this whole issue of disparities is, I think, a much more dominant one in US research, as well as in my research, which is why, you know, it's not that I've never looked, of course, at the US as a whole, but that's not the particular papers that I focused on in COVID, because it's been a very important part of this pandemic. You know, people in the beginning of the pandemic thought, okay, brand new disease, nobody has immunity. We will all be affected, rich or poor, black or white. We're all, you know, subject to getting infected and dying. It didn't take very long for these huge differences to emerge in our society. In infection, in death, in loss of job, in loss of schooling, in mental health, you know, on and on it went. And so the disparities really have taken center stage. I'd love to say one thing, Jim, about your point and just get it back to Ryuichi's point about what will happen to marriage, which is this issue of the young suffering mental health.
Yeah.
Right. And that's been true in the US as well as Japan. And it's been also particularly true for women who are faced with more loss of jobs and simultaneous childcare, as well as, you know, employment or recent unemployment. And that raises also the issue of how will that mental health issue intersect with marriage and fertility post-pandemic among young adults.
So I think we're at about time here. And personally, there are many, many other things I would love to ask both of you. Particularly, we don't have time, but I would love to hear your own thoughts, both professional and personal, on the respective countries' good and not so good responses to the pandemic. I think internally, I think most people see the US as except for the vaccination rollout, a pretty major failure. And I think everybody looking in from the outside sees it as a failure. Japan, I think many people see internally the government response as being quite bad. However, from the outside, people are very jealous and very impressed with how the Japan has responded, at least in terms of the infections and deaths. But we'll have to save that for another time, another topic for another day, as they say. But what I'd like to do is to thank both of you for taking the time to join us here, to share insights from your own work, and to have this short, but I think very informative conversation about each other's research. It's a major, I think, contribution to our bigger effort here to sort of cast a wide net and bring to the table expertise from both of the universities to think about some of the broader implications of the pandemic now and going forward. So with that, I would really like to again thank both of you and to wrap things up here for this conversation. Noreen, Ryuichi, thank you so much.
Thank you very
Thank
much.
you. Thanks to both, all of you.
See you. Bye-bye.
Thank you.